All right, guys, we have a great show tonight. We're going to talk about IBS Awareness Month. We're going to discuss probiotics. Should you take one? We'll discuss what to expect at your colonoscopy appointment. And at the very end, I'll talk about diabetes, the risk it may play inside your gut, and what you can do to improve your gut health if you have diabetes. Guys, let's talk about poop. Hey, guys. My name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, guys, and thank you for watching today. I'm Dr. Islam, and yes, I am your poop guru. Every 2 weeks, I go live on my social media streams. If you want to know when I'm coming on live, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter where you can get great tips and tricks like you're watching in today's video. All right, so I am sorry about the time change for today. I actually have an event to go to in about 30 minutes. So I want to make this Poop Tip Tuesday very short. We're going to focus on the 4 questions I got asked and any questions I can answer for you guys as well on the live stream towards the end, depending on the time. Hope you guys are doing well. I'm sorry about my nose. I am all allergy and stuffed up from the week and from the wind. I hope you guys are doing better from the wind and everything else as well. So I'm ready to get started. Let me know also if you're watching this live or on the replay. And also let me know where you're watching this at. I love to hear where my audience is at. Mona Lisa's good seeing you. Cindy's good seeing you. Wakard's good seeing you. Adrina good seeing you as well. I'm going to try and see if I can answer your live stream as well, depending on the time for today's live stream video. All right. Topic number 1. Did you guys know that this is actually IBS Awareness Month? No, I didn't know if you knew this or not, but this is actually a very important thing to be aware of. And so I'm going to go a little bit about what exactly is IBS. How do we diagnose IBS? And what are the treatment options that we have for IBS? So let me know in the comments down below if you've suffered from IBS, if you've been diagnosed with IBS, or you know somebody who has IBS, because IBS is a very common problem that millions of people suffer from, and a lot of people don't realize that they actually may be having this particular condition. In fact, when you look at the studies, people live years before they get diagnosed with IBS. What exactly is IBS? IBS is a clinical diagnosis in which you have pretty much abdominal pain with a change in your bowel habits. Now, pain is a predominant symptom when it comes to IBS, and with that you have a change in how your bowels are, whether it's a change in how your bowels are working, a change in the caliber, the size, or the consistency of your bowel habits. And the way we classify IBS is that it really just depends on your symptoms, meaning we have what's called IBS-D, which is diarrhea predominant IBS, pain with diarrhea. We have IBS-C, which is constipation predominant IBS, pain with constipation. We have IBS-M, which is a mixed pattern, fluctuating between IBS and diarrhea. Let me know in the comments down below if that is you, because I can tell you millions of my patients suffer from that as well. We have IBS-U, IBS unclassified. And this is exactly how we help to diagnose and stratify what type of IBS that you have. So how do we diagnose IBS? Well, for the vast majority of our patients, it may involve just talking to you guys and doing an exam. And in a lot of individuals, we can have a good clinical suspicion that you have IBS. But for some individuals, we may have to do blood testing, stool testing, checking for a condition called celiac disease, and also maybe check for other conditions such as Crohn's, colitis, sometimes even colon cancer with an endoscopy or a colonoscopy as well. But once we do our testing or we do our exam and history, we can definitively diagnose you if you have IBS. So the big question, how do we treat this condition? Now, what I preface this is that we do not have a current cure for IBS, and anyone who's going to tell you they can cure your IBS, frankly, is lying, because we have no good one-size-fit-all medication or natural options to cure your IBS. However, it really would depend on your symptoms. For my patients, my approach is, if you want to try more natural therapy, we can certainly consider that. Sometimes dietary changes, avoiding certain foods, avoiding certain triggers, managing stress, sleep, maybe getting help of a psychologist or a psychiatrist is a more natural approach. Sometimes we can add in supplements to help out with your conditions depending on what we're treating. But for some individuals, we may need to give you a medication. That is perfectly fine. One of the frustrating things for me is that I know a lot of patients want to have a more natural approach. I am all for that. However, there are some people which we cannot do that. Your body will not allow that. And that is perfectly fine. We have the opportunity to help try a more natural and medical approach, and it really would depend on your symptoms. So for example, if you have IBS-D, we will give you medications to help out with IBS-D. If you have IBS-C, constipation, we'll give you natural options and medical options to help out with IBS-C. If you have a mixed pattern, we may have to determine what is the most predominant issue for you and then address that. But we have options. They work. They're successful as long as we use them on a consistent basis and do a very good trial run. It does not help me, nor does it help you to try the medication or the lifestyle changes for a couple of weeks. I'm like, I'm done. It did not work. No. You need to give it at least 4 weeks for us to have a good clinical response to see if you failed or you haven't failed. But tune in this next month, the next 4 weeks, to my videos, my Facebook, my Instagram, my YouTube videos, so you can get more information about IBS, so we hopefully explain what we can do. And let me know if you have any questions for me when it comes to IBS. Comment down below, send me a message. I want to see if I can do more videos on that as well. All right. Once again, guys, if you're watching for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. My passion is to give you, yes, you, the best tips and tricks so you can live your best life from the top, come on, say it with me, all the way down to your bottom. Now, every 2 weeks I go live on the social media channels to answer your questions. Let me know if you're watching this live or on the replay. And also let me know where you're watching this from as well. Brian, it's good seeing you. Thank you for watching. Jennifer, it's good seeing you. Thank you for watching as well. Jason, thank you for watching as well. Rayma, thank you for watching on the live stream from Idaho as well. Jennifer, thank you for watching from Seminole. And guys, I want to appreciate you guys. Thank you guys for watching. I am limited on time today because I have to be someplace in about 20 minutes. So I may not be able to answer all your live questions on today's stream, but I'm going to get through most of them if I can after I kind of go through some of my other questions I got earlier as well. So question number 2. Hey, Dr. Islam, what should I expect for my colonoscopy appointment? Let me know in the comments down below. Have you had a colonoscopy? Were you scared? Were you worried? I've had one. Yes, your own poop guru has had his own colonoscopy as well. And let me know in the comments if you've had your colonoscopy. But when it comes to a colonoscopy and the appointment, I really think of it as kind of 3 different phases. The pre-phase, the during phase, and the post-phase. So let's talk about all this. So the pre-phase, this is when you're getting ready for the colonoscopy. I know what you're thinking. The dreaded prep. I know the prep sucks. I am so sorry. I know it's not good. I know it's not the funnest thing. Who wants to spend their time in the bathroom? Let me give you some things that we recommend. Number 1 is that we have much better preps that are out there. Yes, we do. In fact, in our clinic, we have a fantastic prep that's a pill-based prep that's been used effectively for a lot of our patients. We also have over-the-counter treatments. The prep sucks. I know. But we have made strides in terms of making your prep better, easier, less and hopefully get you cleaned out. And if you watch some of my videos, I have a lot of information on how to prep for your colonoscopy better. But the prep is incredibly important because I cannot do my job if you don't do your job of getting cleaned out. Yes, I need you to commit to the prep to get cleaned out so I can see exactly what's going on and make sure everything is doing okay. And unfortunately, if your prep is not good, I cannot find what's going on. I may miss lesions. It can lead to bad problems down the road. So please make sure that you get your prep done. The second part is during the colonoscopy. So you come in, we push you to sleep. We use a very safe medication to help put you to sleep quickly and you wake up quickly. And while you're asleep, I can do my job of finding out what's going on. If there is a polyp, I'll snatch it out, get rid of it. If there's issues with diarrhea, I can find out why. If there's issues with constipation, hemorrhoids, pain, I can do my best to find out why. And the fantastic thing about a colonoscopy is that if we take biopsies, if we remove a polyp, you don't feel that. You don't feel pain. You don't feel discomfort. it actually ends up being the best nap of your life. And everyone tells me this. They always tell me, hey, Dr. Islam, can I take some of the medication home? I'm like, no, I am not going to be like Michael Jackson and get in trouble. No way, Jose. But that is the during part of the colonoscopy. And then next we have the after, the post care. And so as soon as we're done, you wake up in the recovery bay. I let you know the results right then and there. Now, if we take biopsies, it may take some time to get those results back. If we take a polyp out, it may take some time for us to get those results, and usually we'll set up a time for us to review the results and get that taken care of you. But usually that day, we don't want you to do any heavy lifting, driving a car, making important decisions. Meaning, if you're a shopper like me, don't shop on the day of your colonoscopy because you may not realize what exactly you're shopping. But by the following day, you can go back to normal activities. So this is kind of the way the colonoscopy works. Typically, you take the prep the day before, clean you out, bring you up here to our place, put you to sleep, use a small camera, take a look from either above or below or at the same time. As soon as we're done, I can let you know the results, and then you can go back to your normal activities the following day. Let me know in the comments down below if you have a question about your colonoscopy or how the colonoscopy is or what to expect with that particular appointment. Because I know that a lot of people may be scared about this, but it's a very safe and easy procedure. And the main reason we do this is because we want to help prevent colon cancer. This is the whole reason why I got into GI, was I want to prevent a cancer that is completely preventable by doing a colonoscopy. All right, guys, perfect. All right, so once again, I am Dr. Islam. If you're joining me live, my name is, I do a Poop Tip Tuesday once every 2 weeks. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and comment. And also let me know if you're watching this live or on the replay. And also let me know where you guys are watching this particular live stream at. I am limited on time today. I'm sorry if I'm not be able to answer your questions. I have about 10 more minutes before I have to leave to go to another event. But I'm going to answer my third topic for today, which is diabetes. How can you improve your gut health when it comes to diabetes? So let me know in the comments down below if you have diabetes and has this affected your GI tract. Because the diabetes can really affect everything that's going on inside your gut. It can affect your esophagus, how you swallow, painful swallowing, and also reflux. It can affect your stomach, causing a condition called gastroparesis or delayed gastric emptying. It can also affect your small intestine as well, because it can decrease the amount of contraction in your small intestine. It can certainly affect your colon as well by causing people to have a lot of diarrhea, but also constipation as well. And so we know that diabetes really affects everything going on inside your GI tract. So I have a lot of individuals that have issues with their gut, and I can fix those symptoms, but the root cause is their diabetes themselves. So how do we fix that? What can you do to optimize your gut health? Well, number one, for anyone who has diabetes, this is one of the very few things I'm going to recommend, which goes against my traditional advice, but you need to have a low fiber diet. Now, fiber for me is the best thing for your gut health, but what we have found is that fiber tends to stay in the gut longer and cause a lot of issues for those people who have diabetes, including gastroparesis. You don't want to have a high fiber diet. It will sit in your stomach, cause you to have bloating, nausea, and pain. So this is one of the very few reasons I recommend for you to not to be on a high fiber diet. Number two is I want you to take small, frequent meals, almost as if you're grazing all throughout the day. Instead of having 3 large meals, focus on 5 to 7 small, frequent meals to kind of get your nutrition up and allow you to eat whatever you can eat as well. Number 3, I want you to have a diet that's low in fat. Fat will stay inside your stomach and not want to leave. And that can be very difficult for those individuals who have diabetes that affects their GI tract, whether it's their stomach, esophagus, small intestine, and colon. And then lastly, the most important thing you can do for your diabetes is to control it. Yes, control it. I can help manage the symptoms when it comes to diabetes, but they're the symptoms, and the root cause is your diabetes being out of control. This needs to be fixed. This needs to be addressed. If you can optimize your blood sugar, if you can optimize how your diabetes is, this is going to help out a lot to keep your gut safe, keep your gut healthy, and prevent long-term complications from your diabetes. This is what I recommend when it comes to your diabetes. All right, guys, perfect. Last topic before I have to go. This is probably one of the bigger topics. Should I take a probiotic? Oh, the big probiotic question. I know people have questions about this all the time when it comes to probiotics. So let's go through this and see if we can figure out exactly what I recommend. So number one, what exactly are probiotics? Let me know in the comments down below if you know what a probiotic is, or even if you've taken it. Probiotics are live bacteria, fungi, or even yeast that you ingest to help supplement what's going on inside your gut microbiome. Typically, it can come as a pill, but for some individuals, it can also be other substances, but something exogenous that you take to go inside your body to help complement what's going on inside your gut microbiome. So how exactly do probiotics work? Well, to be frank, we really don't know. What we think is going on is that you're introducing different and new strains of bacteria inside your GI tract. And by doing that, you can help proliferate the good guys and minimize the bad guys. Because we know that the bad guys cause inflammation, leaky gut, and a lot of gut issues as well. So, big thing, what does the science actually say about probiotics? And you'd be surprised, but we don't have a lot of good research to suggest that taking a probiotic is going to help out. We really don't. And we don't have a lot of good research to say that it's going to actually affect your GI tract, or make things better for you. Having said that, I've had individuals who take a probiotic who feel so much better, and have other individuals who take a probiotic who notice no difference whatsoever. And to be frank with you, there are a lot of other things that you can do for your gut microbiome than take a probiotic, which I'll go into in just a little bit. But in my opinion, it's a lot of marketing, a lot of myth, with a smidgen of science right behind that. And that smidgen of science is okay, but it may not be the best thing for us to always recommend a probiotic. So, should you yourself take a probiotic? Excellent question. In the vast majority of people, it is safe. Now, one thing about probiotics is that they're not FDA regulated, meaning there's no secondary or higher source to regulate what are in probiotics. So, what is in that particular pill may not correlate to what is in the ingredient. In fact, there have been plenty of studies to suggest that if you actually cut open the probiotic and look at it under the microscope, what is in that probiotic does not correlate to what is in the ingredients. We have no way to regulate these. So, what you are taking, you're taking at the mercy of the company that made it, and at the mercy that they're doing a good job. But in the vast majority of people, it is safe, except if you are immunocompromised, you're taking something to suppress your immune system, or you're taking things like steroids, because there's evidence that bad bacteria inside these probiotics can really make you have a really bad systemic and body-wise infection in which your body actually shuts down and can lead to sepsis. So be careful if you take a probiotic, and also make sure you let your primary care doctor or your doctor know. And certainly don't take a probiotic if you are immunosuppressed or you take medications to suppress your immune system. But the vast majority of people, it tends to be fine and tends to be very, very safe. Here's what I look for when I recommend a probiotic. Number one, make sure it comes from a reputable company. Make sure the company has good reviews. It's a national chain. It's not some simple local store, and it has good reviews behind it. Number two, make sure it has good strains that are there, whether it's strains including Lactobacillus, Bifidobacter, or Saccharomyces boulardii. These are particular strains that are known in the GI world to help improve your gut microbiome. And with those limited research that we do have, these are the strains that tend to help out. What I would recommend, to be honest with you, more than taking a probiotic is that you really change what is going inside your body. You are what you eat, and what you eat affects more of what is going on inside your gut than any probiotic that you can take. You cannot supplement yourself to health, meaning if you eat bad but you take a probiotic, guess what? It is not going to help out. Here's what I would recommend. Number one, I would really recommend you have a fiber-rich food. And the best way to do that is to have a wide diversity of plants and vegetables. By far, all of the studies we are seeing now show that the best way to improve and optimize your gut microbiome is to have a wide diversity of plants in your diet. This is key, this is critical, and this actually has science, and it actually works. Number two, consider adding prebiotic foods into your diet. Foods that are fermented. for foods that are prebiotic, foods that can enhance your natural gut microbiome as well, and to make things better inside your GI tract. Number 3, minimize the things that damage your gut microbiome. Processed foods, fast foods, meats, foods that are not naturally made. These things affect what's going on inside your gut. And then lastly, do what you can otherwise to help improve your gut microbiome. Manage stress, get good sleep, go for a walk, exercise, do things like this which will help improve your gut microbiome. And if you do this, I will tell you, your gut microbiome will thank you. You will feel better. And in my opinion, this is almost 100 times better than trying to take some probiotic to see if it's going to help out with your GI tract. All right, guys, I apologize. I have to leave. I have to leave somewhere and be someplace. I want to thank you for watching. If you have questions about probiotics, about what to expect for colonoscopy, about your diabetes, or if you have a question that you want me to answer, comment down below. Let me know. I will hopefully get to it in the next couple of weeks. I may post on Instagram as well, or on YouTube or Facebook. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter where I can give you great tips and tricks which you can learn and hopefully improve your gut health and your everyday living as well. And thank you for watching. I'm sorry I have to cut this short. I'll see you guys in about 2 weeks. Thanks and take care everyone. Bye, everybody.